Renuva is an allograft adipose matrix. So in other words, it's basically a framework for your own adipose tissue to grow. It stimulates adipogenesis, which is growth of your own fat cells. So really different than some of our other biostimulatory fillers like Belafil, Renuva, and Radius, which stimulate collagen production. They all work kind of differently, but it comes as a powder, freeze-dried, and we reconstitute it. It comes in different aliquots. You can get 1.5, 3, and 5 cc's, so depending on how much you want. And I do mix it again with saline, so some of the saline is resorbed. So I don't like to overcorrect, again, because I'm stimulating your own fat cell growth. I want to get it about just right, knowing in the couple weeks that follow, you will resorb that saline, or that, in this case, that platelet-rich plasma I'm using to mix it. But what happens is that resorbs, so you notice an increase in your own adipogenesis or fat cell growth. So it's very different, again, than other biostimulatory fillers. In fact, it's not really a filler, it's a adipose matrix.
So with Renuva, the package insert does have suggested dilutions. To reconstitute, I like to use a little bit more to make almost a hyperdilute slurry. I'm using the PRP here in this system. So again, I'm going to be using that and saline as an adjunct. For the 1.5 cc syringes, I'm using almost 2.2 cc's of probably 50-50 admixture of platelet-rich plasma and saline. And for the 3, about the same, almost 2 cc's of actually fluid to hydrate it. So I want a slurry because, again, I'm going to be using subcision and then injection in a retrograde fanning fashion to place it. So here for the reconstitution, as you can see, it's several passes of using a male to female connector with the 2 syringes, again, to kind of dissolve and suspend all of the powdered Renuva to reconstitute it. And again, I want almost a slurry. When I get a paste, I do like that for other places of the body, but when I'm actually doing a liposuction defect or a cellulite dimple, I prefer a slurry. So here the patient is actually outlined where she wants corrected. I've actually, around the perimeter, you can see 3 points, use a little bit of lidocaine with epinephrine, 1%. Let it sit for 10 minutes for anesthetic and hemostatic effect. And using a cutting 18-gauge needle, I made 3 points of entry. Here's the second one. And here I'm using a blunt 18-millimeter cannula to subside or break up the areas of this patient's liposuction deformity. And again, the passes with the cannula for to perform subcision is probably the most uncomfortable for the patient. And in a retrograde fashion, I'm injecting the Renuva, again, reconstituted with PRP. This patient's had Renuva before, reconstituted with saline. Her comments were that she felt the bruising was less. She also didn't notice any burning or itching afterwards, which is interesting. And there we are, post. I do massage the area and recommend she do so for about 48 hours. She's also been on arnica and bromelain for a week before. Here's her immediate pre and post results, and we're looking at that right lateral thigh divot.